Are you ready to debunk some common pregnancy myths? I'm Nurse Heather, medical advisor with Premom, and I'm about to shed some light on why these myths just aren't true based on the science behind them. So let's get started. Our first myth is you can actually predict your baby's gender based on their heart rate. Total myth, because your baby's heart rate is going to vary a lot during pregnancy. There's just a wide, really broad range of a normal fetal heart rate. So typically in early pregnancy, it's going to be higher, and towards the end of pregnancy, it may lower just a bit. Totally normal. So if you've heard that myth that less than 140 is a boy and greater than 140 is a girl, there's just not enough science to prove that that is true. Our myth number 2 is you should eat for 2 during pregnancy. While you do need some additional calories during pregnancy, eating for 2 can actually lead to excessive weight gain, which can pose a risk to your pregnancy and to your baby as well. So we really want to focus on eating those nutrient-dense foods and not really doubling our portion sizes. So aim for those whole foods, organic if you can, essential vitamins, essential nutrients, and eat as many colorful foods as you can instead of trying to double your portion sizes. Myth number 3, the way that you carry your baby can determine gender. So I'm sure we've all heard this myth. If your baby is carrying really low in your belly, it's a boy. But if it's carrying up higher towards your ribs, it's a girl. While there's so many other factors that contribute to how your baby is carried, we can't accurately say that, yes, this is so true. So the muscle tone, the way a woman's body is built, her stature, her height, and the way that the baby is positioned in the womb all account for where and how her belly looks and where her bump may show the most. Myth 4, spicy foods can induce labor. While as much as you're probably prone to trying this towards those final weeks of pregnancy when it feels like the longest weeks ever and you're just ready to meet your sweet baby and you're over all the aches and pains, spicy food is just not gonna help you go into labor. There's no scientific evidence that has ever been able to prove this. But what spicy food can cause is discomfort, a bellyache, diarrhea, and heartburn. So if you are not normally ingesting spicy foods, I don't recommend eating a ton of them just to try and go into labor because it's not going to be a good outcome. Myth 5, the shape and size of your breast can affect breastfeeding success. This is not true either. What affects breastfeeding success is a proper, efficient latch, the efficiency of baby suckle, and supply and demand. Are you feeding your baby enough? Are you feeding them when they're hungry? Are you feeding them, not 5 and 6 hours apart? You're feeding on demand. So all of these things come into play when we talk about breastfeeding success. So if you're worried that your breasts are too small or too large, this isn't going to affect your success rate. Myth number 6, you can prevent stretch marks by using certain skincare products. While many women would love for this to be true, it simply isn't, just because genetics and hormonal factors play such a big role in the development of stretch marks during pregnancy. As your skin stretches, it may tend to get itchy and may even be a little bit uncomfortable. So you can apply those topical ointments, lotions, and certain skincare products that your doctor has okayed, but it's not necessarily going to decrease your risk of getting stretch marks. It's more of just a genetic and hormonal thing. So if you do get stretch marks, wear those stretch marks with pride. You're growing a whole human. That's amazing. And you gotta make room for that sweet baby. Myth number 7, if you have a lot of heartburn during pregnancy, your baby is gonna have a head full of hair. While many women would also like for this to be true, because who doesn't love a fuzzy-headed baby? But genetic factors are what is determining your baby's amount of hair, not how much heartburn you've had. So heartburn is typically caused by hormonal fluctuations, especially progesterone, because it can relax some of the muscles up here, which can lead to an influx of food coming upwards, causing that heartburn and GI discomfort. So genetics win here again. Myth number 8, craving salty foods means you're having a boy, and craving sweet foods means you're having a girl. Also not true. A lot of these pregnancy cravings that you may or may not experience are influenced by hormonal factors and not your baby's gender. So if you're craving something sweet or salty during pregnancy, don't immediately think that you're having a boy versus a girl. Myth number 9, baby's movement should decrease towards the final weeks of pregnancy because baby's just running out of room. This is not true and can actually be really dangerous if mom notices a decrease in her baby's movements but doesn't report it to her doctor. We always want to notice our baby's movements and be counting kicks if we feel the need to. So if you have noticed a decrease or a change in your baby's movements at all, it's always a good idea to consult with your healthcare provider or your doctor. So make sure that you are always monitoring your baby's movements. Those movements may feel a little bit different than they did at the beginning of pregnancy because your baby's just a lot bigger, but you shouldn't have a decrease in movement. And finally, number 10, if you have severe morning sickness, you're definitely having a girl. While this can be true for a lot of women, it's just not a reliable indication of gender yet again. What causes that morning sickness or that nausea and vomiting is an increase in HCG, the pregnancy hormone. This typically peaks around 6 to 8 weeks of pregnancy, so that's when a lot of women will start experiencing this, and it can be true whether you're having a boy or a girl. If you liked this video and want to see more of our content, don't forget to like and subscribe. And if you have any additional pregnancy myths that you find interesting, please drop them in the comments because we would love to hear them.